Okay, well, look, thank you everyone for joining us, and welcome to the Health Services SBAT information session for 2022. So my name is Angela Byatt, and I work for the Frankston Mornington Peninsula LEN, and I help coordinate this program and bring everyone together, so the schools and the students and the employers and training providers and all the other support people. So thank you for coming today. My role in this session will be coordinating the speakers, and they can talk to you about what is planned for 2022. But before we get underway, just a couple of things to mention. Bear with me. Right, before we start, you should have had a prompt to say that this session is being recorded. We are recording it as a resource for those students who may have been held up and can't attend today, or there may be a few late expressions of interest, so we will use this as a information session for them to tap into later. There is a lot of information that we're going through as well today, so if you would like to tap into this, I will send out the link for the video later, and you can actually refer back to it again. I think most of you have already done this, so type your name in chat if you haven't already, and I'll mark that as attendance. Pre-COVID, we would have held these sessions face-to-face, and we are still in some sort of limited restrictions, but we are running this online today. So whilst this is an information session, I would encourage you to put your cameras on if you feel comfortable, because it is a chance for us to meet you as well. If we were face to face, we would have that opportunity. It's always good to actually talk to faces rather than a whole lot of black screens with names on them. So yeah, please keep your mic on mute, and should you have a question, I can urge you to just pop it in chat. Or put up your hand, and there's also going to be a Q&A session at the end. So I think with all of that, we're probably good to make a start. I would just double check to see if, is Damien here yet? Oh, Mary's turning up.
I haven't had a reply. I've actually just messaged Rebecca Moss, Angela.
Oh, sure. Okay.
Just to see if she's had any contact with him.
All right, no worries. Well, what we could do is, I mean, I'm doing a bit of an introduction. I could actually jump to Kangan if need be. If Janice, you want to talk about the training before Damien or Rebecca come on board, but I'll talk for a couple of minutes and then we'll see where we're ending up. Okay, so just a reminder to put your mics on mute. I think I can hear someone in the background there. Thanks, guys. Okay, so the 2022 program is going to be the third Health Services SBAT program we've run, and we're really looking forward to running it under hopefully some more normal circumstances next year. Despite the lockdowns over the past 2 years, the students who have come through the SBAT program have done extremely well, and we will actually hear from one of our completing students, Bella, shortly about her experience. So students, you may be a bit surprised to see that we have a number of additional adults in this session, and I think it's important to acknowledge that the people who are involved and invested in this program and who are here tonight. The SBAT program of this sort of size does take a lot of coordination and a lot of commitment from a lot of people, but it's definitely worth it in the end. So there's a number of people that are involved with an SBAT, and we are talking about, we have employers such as Village Glen, who are the lead employer for this program, and we're here at its inception. They will be offering a number of positions over their Mornington and Capel Sound campuses. We also have Craig Care in Mount Martha, who is another aged care facility, and they've been with us since the beginning, and they're going to be offering 4 positions as well. Unfortunately, they can't be here today. There's a new manager that is about to start and was unable to be part of this, but they will be able to do a meet and greet with you in the new year if that is one of the centres that you're interested in going to. We also have Bella Herring, who is a SBAT student from the program this year, who will briefly speak about her experience at Village Glen. We have Kangan Institute who are here, and they are the training provider who will deliver the Certificate 3 in Health Services Assistance. And we've got Janice who will actually talk a bit about what that entails and the expectations of the training. We also have Jess Murphy from MAS National, who will speak about how an SBAT works and how a traineeship contract works. And we also have the Head Start team. I would like to welcome them, who are working with most of you to get organised to undertake the SBAT, and will be an integral part of getting you established in the SBAT program and offering support during your program next year. So thank you for the team from Head Start to be here as well. And we'll talk about the next steps beyond the information session and how they will assist you. So I'd like to welcome you all, and I'm going to stop sharing. And here I am. Oh, look, we're all in a nice gallery view at the moment. So just speaker, there we go. That's a bit easier. Okay, so this SBAT program is a great way to enter and explore the health services industry. And probably the best place to start would be to talk to the employer, Village Glen, about what life is like working there. But are we still waiting on someone to talk, Faye, from Village Glen?
Yeah, I've actually reached out to Beck and Damien. Beck said that he is intending to jump on.
That's okay.
If I hear something different, I'll let you know.
That's fine. And if not, I'm sure I'll be able to talk my way through it too. Well, maybe, Janice, would you mind, can we throw to you, and maybe if you can actually talk to the students about what the training in the Cert 3 in Health Services looks like with Kangan, please.
I'll just share my screen.
Oh, actually, yep, you got it.
Does that work?
Yeah, I can see that.
Great. Okay, so good afternoon, everybody. So my name is Janice Martin, and I am the Education Manager for the Health portfolio at Kangan Institute. Angela has invited me today to talk about the Certificate 3 in Health Services Assistance school-based apprenticeship traineeship program. This is the third year running, as Angela said, so I'm just going to go through some information and I'm happy to take any questions at the end of this. So a little bit about Kangan Institute. So we've been operating since 1925. We've got 5 campuses across Melbourne, in Richmond, Docklands, Moonee Ponds, Essendon and Broadmeadows. We're also regionally across Castlemaine, Maryborough, Bendigo and Echuca. So we have around 14,500 students each year studying at Kangan Institute. We have more than 250 courses and quite a lot of staff that support the delivery of our programs. So the Health and Community Centre of Excellence is where I sit, and we deliver health programs to people entering the workforce, as in traineeships, or people wanting to study on campus to then gain employment post-study. We have facilities at our Moonee Ponds and our Essendon campus, and we're building a brand new building at Broadmeadows campus as well, just for health. So some of the courses that we look after within our portfolio is around aged care, or the Certificate 3 in Individual Support, Certificate 4 Leisure and Health, Home and Community Care, which is part of our individual support program, We've got Certificate 3 and Certificate 4 in Allied Health Assistance, the Certificate 3 in Health Services Assistance, which is what we're talking about today. We've got the Diploma of Nursing, we've got Pathology Collection, and a Certificate 2 in Health Support Services. So some of the supports that are offered at Kangan Institute that are available to all of our students, regardless if they're a trainee, workplace-based, on campus or online. We offer counselling services that are on site. They also can be via text, via video, via phone. We also have a Talk Campus app that allows people to talk to people through a mobile app. We've got library services that are predominantly online and library services, e-text, e-journals, supports, disability support, welfare, learning support, digital literacy support. We've got the Indigenous Education Centre, and we've also got a volunteering program for students interested in volunteering. So all of those services are available to all of our students, and they would be available to you as a student of Kangan Institute. So studying at TAFE is quite different to secondary school. It's expected that students can manage their own learning with support from the teachers. As I said, we've also got the other supports, the learning support and the library support, that also help you manage your own learning. Attendance and participation is not mandatory, but we say it is essential. It is also part of your SBAT program that you attend a certain amount of hours of learning and work per week over a 4-month period. But also attendance and participation enables you to actually learn and progress in your course at a satisfactory level. And the more that you're engaged in the learning and the activities that are provided both in the class and also outside of that will enhance your knowledge and skill in the area. And the job outcome predominantly for this qualification is a patient services assistant, and they have a wide variety of duties within an organisation, and we'll go through some of those shortly. So why a traineeship program? So it's really a good way to study because you're incorporating the training, the knowledge and the skill of the role, but you're also working in combination with your senior secondary program, and you're also getting the workplace experience at the same time. The program can provide some credits, but more information you would get from your schools around that. You can jumpstart your career. So at the end of this and at the end of your senior secondary, if you're in year 12, you'll be able to gain employment into health straight away with this qualification as a patient services assistant, a health assistant, an orderly, so one of those roles, and it also leads you to further pathways. You can earn money while you're actually doing this program, traineeships, and you're getting real hands-on experience. And this program itself also enables you to work in different areas within the sector so that you can get a little bit of a taste of administration, food services, cleaning, patient care, that sort of thing. It's generally a 12-month program, and this program is for 12 months. So it starts in February and ends in around October-ish. You'll have a workplace supervisor allocated to you in the workplace that will oversee your workplace learning. And our educators will come and visit you in the workplace to be able to conduct assessments and see how you're progressing. And as I said before, a combination of training and employment is around 13 hours a week over a 4-month period. So some weeks it may be less, some weeks may be more, but on an average it's 13 hours over 4 months. So what happens with the traineeship is Kangan Institute gets notification that you've got a approved training contract, which Jessica will talk about a little bit later. Once we get that, then we can actually make contact with you. We assess to make sure you meet the entry requirements, and then we go through the enrolment process with you. Once you're enrolled, we're obliged to provide you with a training plan which outlines all the units of competencies, the dates proposed start, the proposed dates of finishing, the types of assessments and delivery. And that then goes to you, your parent guardian, if you're under 18, your schools and the employers to all approve and sign. And any changes along the way, that training plan gets updated. So what we provide as far as the program goes, we provide weekly attendance reports to the employers in the school. We will apply a monthly progress report so that they can see how you're progressing. We'll notify schools and employers of any trainees that are at risk of non-completion. So this may be due to long absences or due to their assessments aren't at a satisfactory level. And we would work with the schools and the employers to actually put supports in place to ensure that you, progress satisfactorily towards the end of the program. We provide a mid-year and an end-of-year report to your schools and also then completion by the VCAA date to say to the schools that you have completed so that they can contribute to your senior secondary qualification. So the Certificate 3, it covers a range of work roles. You provide assistance to health professionals, whether that's in a healthcare setting, an aged care setting, or a community health setting. You work under the supervision of a healthcare professional, not directly under supervision, but they will actually guide your duties for the day. The qualification has a total of 15 units or modules. We've got 7 core, they're compulsory, they have to be completed. And then there's 8 electives that are chosen. And these ones are chosen to give you a good overview of the types of roles that our health service assistants will do once they graduate, so that it will actually increase your employability. So the core units that we have are around communication, working with diverse people, around anatomy, so basic body structures, body systems, how the body functions in a healthy way, infection prevention and control, looking at work health and safety, about medical terminology, so that health language that all health professionals use, and how to sort of interpret that. And then organising your personal work priorities and development. So this unit here looks at your work duties for the day, how to prioritise them, how to get them done, and also how to engage in professional development to keep you always current in your role. The elective units we look at is beds, so preparing, making, cleaning beds, transporting individuals in wheelchairs, trolleys, beds. Customer service, we look at basic food preparation, cleaning, responding to behaviours of concern. So some clients, some patients, some visitors may be exhibiting behaviours that aren't appropriate, and you learn how to manage those. We look at distributing food, so getting the food trolley, distributing the meals to patients. And assisting with movement, so off the bed, onto a chair, from a chair to a wheelchair, that sort of thing. So they're the units that you will cover across the 12 months. Assessments are varied. There's online quizzes, so there'll be multiple choice, true and false, and there'll be role plays. So this is usually around communication. Short answer questions, case scenarios, you'll have some research to do, some group discussion tasks, workplace assessments. So we actually have a range of assessments so that all students have an opportunity to show their knowledge in a variety of ways. The materials are all in our online portal, which is called My Learning. So all your unit materials you'll have access to, everything is in there, all your materials, your assessments, all your grades, your marks, your results, your feedback from your teachers, everything is in that portal. So as you're introduced to a unit, you'll get access to that unit. It'll have all your due dates for your assessments, etc. in there. There might be some external modules that you can need to complete, like Hand Hygiene Australia has a hand hygiene module for healthcare workers. You'll be asked to complete that, for example, and provide the certificate as evidence. You will have to have access to a computer and the internet outside, you know, like whether that's at home, in the public library or at school. You won't be able to do this on a mobile phone or a tablet. You will need to have a computer, whether that's a laptop or desktop. And you'll have access to the Institute library for any resources. Study, so outside of the classroom, study is expected to 2 to 4 hours a week. It depends on the unit, depends on some units are 70 hours, some are only 15 hours. Depends on the unit, depends on the content as to how much you need to put into that to, you know, to learn and to complete your assessments. So some of the duties that you will do is cleaning. So cleaning is a big part of this qualification. That's your general cleaning of the ward areas or the, you know, the public areas such as the dining rooms. It could be the administration areas, etc. So learning how to clean appropriately, even high touch areas and deep cleaning. Bed making, how to clean them, how to make them for various situations. Assisting with movement with the mechanical hoist or the stand lifter or with slide sheets. Transporting individuals, it could be on trolleys, wheelchairs. And serving meals to patients or residents. And then other duties might be running errands like, you know, an extra meal, a cup of tea, a piece of equipment somebody's asked for that you've gone to get and take that to them, a pathology slip, a medical record, could be some administration tasks. And, you know, you might be involved in things like audits, you know, like a cleaning audit or a food audit, something like that. So some of the careers, the main one is the patient services assistant, but you could also be a ward assistant, an orderly, food services, cleaner. There's a range of different career opportunities with this qualification. Some of the pathways. So you're here at the school-based apprenticeship, the little blue square box. And you can go into a range of different areas. There's ambulance, there's client care, which is direct client care. There might be technical support, and there's administration. And you can move from a certificate 3 into certificate 4 and onto diploma courses. So there is a lot of scope for pathways into a range of other health areas. And this qualification gives you good scope to learn about those other areas whilst you're doing the traineeship. So what are the entry requirements for the course? So you need to do a language literacy and numeracy assessment and meet the minimum levels, which is a level 3 in both numeracy and literacy. That's an online assessment. Attend a pre-training review. And what this interview is to really make sure that you understand the qualification and what you're getting into, and for you to ask any questions. So it's really about making sure that you have all the information you need to make a choice and to ask any questions that you have before you actually enroll. You'll need to be employed as a trainee and also be at school. You'll need a unique student identifier, which you will have through your school, and you must be COVID double vaccinated. That's mandatory for all enrolments. If you've done other similar courses in the past, you may want to, but you haven't got a qualification, you may want to apply for recognition of prior learning. And you can talk about that when we do the pre-training review. Similarly, if you've done some other studies in the past and the units are exactly the same as what's in this qualification, you may qualify for a credit transfer. And once again, we can talk about that at that pre-training review interview. Attendance, so classes are held on a Friday. They're from 9 till 3. We don't have any classes during school terms. And it's online face-to-face. So we usually do a mix. It depends on the situation at the time, but we'll sort of confirm that a little more once we come back next year. And your working day in the workplace is on a Wednesday. So the program is commencing about Friday, the 25th of February. This isn't set. This is an estimated date. We're still to confirm this, which will mean that training will definitely need to finish by the 21st and the 28th of October, because then we need to finalise the results and get them to the schools before that VCAA date. We talked about the USI. So what happens is the next steps will be to sort of sign up for the traineeship, meet the eligibility. We'll do the numeracy and literacy testing. You'll need to do a digital enrolment, and we've got a administration person who you'll deal with directly, and they'll assist you to complete that digital enrolment. You need to provide eligibility and proof of identity of being able to study in Australia. You'll need your USI, you'll need proof of your COVID double vaccination, and the payment of fees is around $150. It won't be any more than that, and that is required at the time of enrolment. So that's all from me. If there's any questions, or we can take questions at the end, I don't mind, Angela. You're on mute, Angela.
Sorry, I did press it. I didn't press it hard enough. Oh, how many times have you heard that saying? You're on mute, hey? Hopefully we won't be doing this forever. Thank you very much, Janice. That's a lot of information, but really good to go through. If there are any immediate questions, I'm happy for anyone to chip in now, or we can just move on and have questions at the end. No? Look, I think we might just move on.
I'm happy, Angela, if anybody wants to ask questions in the chat, and I'll just reply in the chat.
That sounds great. Let's do that. Now, I did notice that Damien has joined, or has joined us. Let me just check. Yes, hi, Damien. I can see you now. Thanks for coming in, and I know you're extremely busy. So Damien Malone is the operations manager at the Village Glen. And as I mentioned before, Village Glen were at the inception of this program and was very much leading the charge with this program. So Damien, if you would you like to perhaps talk about what work is like at Village Glen, a bit of background, a bit of context to the SBAT program?
Well, thanks, Angela. Sorry, I was running a bit late, but it's been one of those days. Hi, everyone. Thanks for coming along to the information session. As Angela said, I'm Damien. I'm the operations manager at Village Glen. I look after our 2 aged care facilities. We have a 194-bed aged care facility at Rosebud and a 92-bed aged care facility at Mornington. They're owned by a family, the Jacobson family, and they've been working in aged care for over 40 years now, with retirement living, residential aged care, and also home and community care. The aged care facilities provide a whole range of opportunities for people to explore different work options, and that's why we became involved with the SBAT program, was to give, I guess, younger people a bit more of an opportunity to have a look at what career pathways they are in aged care, that they're not the dark and dingy places of the past, and that there's actually a different way to get to where you want to be in your career by working and learning at the same time. So at Village Glen, we provide full residential care for people who are generally high care in nature, meaning they need a whole range of support from a clinical point of view, from housekeeping, from meal preparation, allied health support, lifestyle and socialisation programs. And what the SBAT program does is give students an opportunity to come in. They do some rotations through various departments. So you'll have an opportunity to work in administration, You'll have an opportunity to work in allied health. You'll have an opportunity to work in housekeeping and laundry. You'll have an opportunity to work in catering, and you'll have an opportunity to work in lifestyle, just to see some of the different job roles apart from the traditional care and nursing that people see. We've been doing the program at Village Glen for 2 years. This will be our third group that we're taking, and from both groups, we've had high percentages of the students that came through have gone on to permanent employment or regular employment at Village Glen. Some of them working in the kitchen, some working in cleaning, some have gone on and done a personal care traineeship, some have gone on and done their lifestyle certificate, and you know, there's the opportunity to then go on and do things like your diploma of nursing. So there's a whole range of different options where instead of leaving school, going to uni, you can work your way through, get all that experience. The residents at Village Glen love having the SBAT students there. They really enjoy the variety of having some different people and some younger people, and it gives you a good opportunity to understand what life's like in an aged care facility and the benefits you can bring to the residents by coming to work there and sharing, I guess, your time and your experience with the residents and getting an opportunity to hear from them and hear from their experiences. Village Glen, we're really lucky because it is family owned. They've got real family values. The Chaz is a builder. He's put he's put so much effort into designing and building high quality facilities. The equipment we need, we have, and the support is amazing, and it gives us an opportunity to run innovative programs like this. How's that, Angela?
That's great, Damien. That's a terrific sort of summary of what you have on offer. Could you perhaps also talk to about, there are some mandatory requirements to undertake the SBAT. Janice touched on the necessary vaccines, including the COVID double dose. What other requirements do you need to have students?
Sure, thanks for that. So yes, anyone who works in aged care, as you imagine, we're working with vulnerable people. So everybody needs to have their COVID vaccinations. They need to have a flu vax if it's available to them. And we require people to have a clear NDIS check, which is because we do have some residents that fall under the NDIS system in our facilities. So we require an NDIS check. The other thing I should just mention, based on Janice's presentation, that is, you are employees of the organisation. You're not students at the organisation. You're actually employed trainees, which means you have all the obligations of any employee. So if you're rostered on for a day to work, you need to attend that day at work. If you're sick, you need to ring up and let the facility know. We do require we do require you to do your training. That's part of the obligation that you make. So if there is class days, you are expected to attend class. That's part of your employment responsibilities. Yeah, so they're the main things.
Yeah, actually, that's a really good point too, Damien. So when, say, for example, we were in periods of lockdown over the last 2 years, the students did actually still attend the workplace, didn't they?
Absolutely. So we didn't have any downtime with our SBATs over the last 12 months. They came every Wednesday, continued doing the work they were doing, train you in PPE, train you in how to keep yourself safe and how to keep the residents safe. So that obligation continues.
Terrific. Yeah, that's a very good point. And you're right. So the students, while they're attending the workplace, are employees and should be, they will be rostered on as an employee. They will be paid accordingly to the apprenticeship contract. And yes, if they are actually unable to attend, they have to notify you as the employer and not the school. So it's good practice for the real world and actually practicing how to work as an employee. Terrific. Have we got any questions for Damien at this point? Or if you'd like, you can put them in chat and we can follow up later. Yes, that's Sarah, but not Sarah. If you'd like to unmute yourself, if you feel comfortable, you can just ask the question directly or just pop it in chat. We got any questions?
So there's a question there about uniform. So yes, you
Oh,
are
there we are.
subscribed with a work uniform.
Yes, terrific. Anything else? That's okay. Look, what we will open up for questions at the end. And Damien, if you do need to go, I'm sure we will be able to answer those. If not, we can certainly get those questions to you and ask you to respond if that's okay.
Yeah, that's fantastic. Thank you.
All right, lovely. Thanks so much for coming, Damien. I really appreciate it. Okay, so we have, is Bella still with us?
Hi, yeah, I'm still here.
Oh, there you are. Hi, Bella. How are you going?
I'm good. How are you?
Yeah, really well. Thank you. Thanks for joining us. Just for
Okay.
everyone's benefit. So Bella Herring is an SBAT student who you've completed now, haven't you?
Yeah.
Yeah. So Bella did the SBAT this year and she's kindly agreed to come and have a chat. And I guess this is probably one of the important things, is to get a bit of feedback from a student on how your experience was. So let's start by, why don't you start by telling us a little bit about your experience doing the SBAT this year?
Well, so I was at Capel Sound for the one about Damien works, and it was a really amazing experience. The staff there were amazing, and as I said before, in each department you get like a little buddy, or you'll get like numerous who mostly work and then normally with them, and it was really amazing. You got to like create bonds with all the residents, and which was really special. And yeah, you see different things, like from working in a kitchen to working in admin, and you see what you like and what you don't like, and it's a really amazing environment to be in.
Oh, that's terrific. And so what did you learn during your SBAT? What was some of the key things that you got out of your training this year?
Probably how to handle working with the residents, I suppose. Like, obviously you can go from having an amazing, lovely resident to someone who might not be as happy. So kind of working in those difficult situations and all the privacy and confidentiality and all of that. I learned a lot about that, and all the food rules and everything. Probably those ones I learned the most.
Oh, that's terrific. Yeah, I guess, yeah, there is, communication skills are really important in this role, aren't they? And learning to communicate with lots of different kinds of people. So, yeah, that's really important. So what about where to now? What's your next step? What's your plan?
I was actually offered to do the PCA course at Village Glen as well. So definitely jumped on the opportunity to do that. So that starts next year. I think it's about 6 months. So I'll be doing that, and then my end goal is to be a paramedic. So I'm kind of stepping my way towards there.
Oh, that's fantastic. That sounds like you're really on the way to it too.
Yeah.
Terrific.
Yeah.
Oh, that's great. That's really terrific. Well, look, I thank you very much for waiting to have a chat, and
No
really
worries.
appreciate it. And thank you, and the best of luck for next year and your journey continuing on. So
Thank you.
thanks
so much.
Bella. Okay, so I'm conscious of time. I want to make sure that we're moving on. So I think I might hand over to Jess Murphy now, who's from Mas National. They are the apprenticeship support networks providers, and Jess will explain how the contract side of things work relating to your SBAT. Over to you, Jess.
Hi guys, how are we? So I'm not probably going to talk about too much because it has been pretty much covered in relation to, from Damien's perspective, and also Kangan have mentioned it briefly. But from my perspective, we're actually a federal government representative to complete the training contract with the RTO, the employer, which would be Village Glen or another provider if there is one, and yourself as the trainee. My job is to make sure that everything runs smoothly, and we're basically the glue that sticks everyone together. Doing a traineeship and an SBAT is a great opportunity to earn whilst you're learning. You are committed to 13 hours a week of work and study, but those hours can increase depending on time, and you can also do more in the school holidays, which is great for you guys. Your career is endless by doing a traineeship. This opportunity is such a fantastic opportunity to get your foot in the door into the healthcare sector, and depending on where you want to go, you can go anywhere. The sky's the limit, just like you heard from the young lady that was just talking before me. So what you will be doing, if you do decide to proceed and continue on with a traineeship, in particular the school-based apprenticeship, you will be committing to turn up to work, abide by your employer's instructions, and also work towards the training qualification, which is Cert 3 in Health Service Assistants. Does anyone have any questions about how we work as a apprenticeship centre?
I think they've all gone quiet. They're probably scared off by all the information we've dumped on them today.
That's why I didn't want to talk too much. But.
Oh, thank you. Well, look, the thing is, even if there are some questions that pop up later, there's ways in which we can actually get the information to you. And I think that's sort of a nice segue onto the next steps. If you're happy for me to roll on, Jess.
Go ahead.
Okay, thank you. Look, if you do think of any questions, students, just pop them in chat, or we can have a chat at the end if need be. So I'm just going to share my screen again. Where are we? Sorry, excuse me. Getting there. All right. Just bear with me. Next steps. Okay, so yes, so these information sessions are always a big sort of amount of information to be putting on you. So I do apologise, and it probably will take a bit for you to digest. There are, as you've probably gathered, quite a few people in the mix to make this happen, and there's going to be quite a few steps. If you are willing to, if you're wanting to go ahead, and look, I have to say, we've all seen such great outcomes. Bella is one. We've seen so many great outcomes with students doing this program, and especially even during these difficult times, it's certainly worth considering if you are looking for a pathway into health services and beyond. So if you are wanting to go ahead, what we urge you to do is you need to make contact with your Head Start coordinator. Now, all the students, with the exception of one, is part of a Head Start school. So you should be aware of who your Head Start coordinator is. We do actually have a list of the expressions of interest who have been sent through. So if you're a bit unsure, then they will contact you as well and have that conversation. So the Head Start team will help you navigate the next stages, and there is quite a few things that you'll need to do, and we've already touched on before. So things like signing up with MAS, your apprenticeship contract. You will also need to sign an employment contract with Village Glen or Craig Care, whoever's going to be your employer. And also too, as part of that, you will need to have your mandatory vaccine and checks done before you can sign that employment contract. There is also too the pre-enrolment process that Janice talked about, and the LLN assessment for Kangan. Then there will be the conversation around commencing employment. Now, there is the opportunity to potentially, if you are looking for some summer work, that you could commence your employment earlier than the start of next year. But again, that's something that you will need to have a chat to your coordinator about. Narissa, your person to speak to about this will be Leanne Patterson. And she and I will work together to help you through these steps too. So yeah, so there's conversations around employment start date and commencing of training. I had early March, but as you saw, it is actually probably more like February, which would be a better start date to get completed in the right amount of time. Can I just stress that you must, over the next month or two, leading into next year, please regularly check your emails and also answer your phone, because it may well be someone from one of these stakeholders wanting to make contact with you to start things moving. So that's always been a bit of a sticking point, and it's very important, especially it's good practice too as you enter into the world of work, that you are easily contactable as well. So any questions about that? No, this is all so easy. Oh, sorry, bear with me. I'm just, where's my, hang on. Oh, my computer's gone funny. I'll stop sharing now. Is there, we're all good? No one else wants to mention anything? Have we still got people? All right, well, look, I think it's probably a good time to finish. This session will be, is being recorded, and I will also make the session available if you wish to go back and look over some information. So yes, I would urge you to get in contact with your school or your Head Start coordinator about commencing the next steps. So thank you very much, and I hope you've really enjoyed hearing what we've had to say today.